Good to know you're still with us. We're talking Nigeria now. Resident doctors under the umbrella of National Association of Resident Doctors, NARD, at 8 a.m. West African time today commenced a warning strike proposed to end 8 a.m. on Monday, May 22. According to its president, Emeka Orji, the decision was reached at an extraordinary National Executive Council NEC meeting held virtually on Monday. The association had on April 29 issued a 2-week ultimatum to the government to meet its demands or face industrial action. Reacting to their demands, the Minister of Labour and Employment, Chris Ngige, described the demands by the doctors as absurd. Mr. Ngige said the resident doctors are suffering from what he described as entitlement syndrome, insisting that the federal government has gone to great lengths to give them everything that they want. There's been further update to what the minister said. I think one of the comments is that the strike is illegal. He also said that the Minister of Health will instruct the teaching hospitals to employ ad hoc staff for the days that these doctors will be on strike. To help us understand this development, it's not a new one. Resident doctors often seem to go on strike in Nigeria, and this is worrisome. To speak on this, we have Dr. John Oladapo, General Secretary, Association of Resident Doctors, UCH Ibadan, or your state. Thank you very much for joining us. We also have Bernard Fatoye, Global Health and Development Specialist. He joins us from the United States. Thank you, gentlemen, for joining us. I understand Dr. Fatoye is yet to join us. As soon as he does, we will welcome him. But let's start with you, Dr. Oladapo. What are the specific demands of NARD this time that they want the Nigerian government to deal with ASAP?
Thank you very much, your listeners at home. So it's a privilege to be here. The demands of the Association of Resident Doctors are quite clear, and it is that the government of Nigeria should be alive to its responsibility, and these are specified in our demands as laid out by the National Executive Council, which had a meeting in Abeokuta about 3 weeks ago, and also had an extraordinary meeting on Zoom 2 days ago. The demands are clear. One, the medical residency training fund for year 2023 has not been paid by the federal government of Nigeria. These are specific demands. Following, we also need to talk about the white paper that talks about one-on-one replacement of healthcare personnel that resign from the system. In the last 1 year, we have over 500 healthcare workers resigning from University College Hospital alone. So it is important that we highlight these issues to the Nigerian public and also bring these demands to fore. The issue of infrastructural decadence and decay is also something that is to be emphasized, and we have also placed this demand before government. And then the review of the consolidated medical salary structure, which government has not opened any form of negotiation with the National Association of Resident Doctors. So these are our demands, and they are specific. And
your demands obviously sound. Your demands sound important. Some of them, your president has said, can be dealt with immediately, while some require some long-term action. Why then, if these demands are so urgent that the Minister of Labour and Employment, Ngige, is saying your demands are absurd and insisting that the government has gone to great lengths to give you everything that you want? Why that reaction?
The reaction of Dr. Chris Ngige is at best not expected from a medical elder himself. One would expect that he himself, being a medical elder and having children in the medical profession, would see our demands from a different light. The 2023 medical residency training fund has not been paid. And our resident doctors have gone for exams in February, March, April, and they're also going for exams in August, September. So if you say that the demands of the resident doctors have been met, then why is the 2023 medical residency training fund not being paid? In addition to that, we have this obnoxious bill by Honorable Daniel Johnson that is proposing to keep resident and young Nigerian doctors for 5 years in the country without a permanent license. So that's obnoxious to the best of our reasoning. So we feel that this bill should be withdrawn, and the federal government should come out with a stance that condemns that bill, and that bill should be withdrawn forthwith. And that's our demand. So it is regrettable to say that the demands of the Nigerian Association of Resident Doctors have been acceded to. There's no collective bargaining agreement as to the 25% that the government is offering.
Okay, I understand.
Or from the Federal Ministry of Labor.
All right, I'll come back to you, Dr. Oladapo. I think we have Dr. Bernard Fatoye now. He joins us from the U.S. Dr. Fatoye, thank you very much. I'll just go ahead and put you on the spot. What is your considered opinion about the implications of the strike on general health systems in Nigeria, considering that this is a very essential service that these doctors are providing?
Yes, I mean, it's unfortunate that we're here again. And I mean, your question is quite important, because in the long run, it's part of the system, and the essence of the system is to provide health outcomes for the populace. The resident doctor makeup, I mean, if I remember correctly, it's probably like 40% of the workforce. We know the condition of our health system, basically provision of services is heavily dependent on the public facilities. And so in essence, and what's going to happen in a nutshell is the best way to look at this is from a systems perspective. When you have a part of the system that is non-functional, then it's going to have a ripple effect on other part of the system, and eventually, of course, the outcome is that we're going to have poor health outcomes, which of course will lead to poor health indices. Maybe to break it down a bit, to give you a case scenario, in this, of course, the warning strike, 5 days, but in this short period of time, we're going to see cases of people not being attended to, definitely. As much as possible, the hospitals, that's public hospitals, will want to run skeletally, but we all know what happens when resident doctor who happens to be the major backbone of this public hospital when they go on strike. So, and because our systems are not resilient enough, and we have a robust communication within the system as a whole. So you'll find a situation whereby today someone is going to write a referral in a private hospital, or even in the secondary level hospital, and refer to a tertiary hospital, and a patient is going to go to a tertiary hospital, hoping to get attended in a clinic, and that's not going to happen. So these are real life scenarios. This is what is really going to happen on ground. So you find out people are going to end up, having to endure more pain, depending on the conditions, endure more suffering, and of course, more money being wasted on unnecessary inefficiency and wasting the system. Yeah.
All right, I'll come back to you in a bit. I just want to clarify something from Dr. Oladapo. There is something that your president of NARD, said. He said the strike will involve the clinical and emergency operations of hospitals and not just doctors. Could you explain what this really means?
So I didn't get you.
Okay, I was referring to a statement by your president of NARD. He said the strike will involve clinical and emergency operations of hospitals and not just doctors. I want to understand what this means really before I phrase my next question.
The members of Nigerian Association of Resident Doctors offer both emergency services and clinical operations, and our strike involves both clinical services as well as emergency services. But like you know, we would not obstruct other cadres of doctors, which are consultants and principal medical officers, who are not members of the Association of Resident Doctors, from carrying out their legitimate duties, which is to take care of Nigerians. But our members will not participate in these clinical duties and emergency operations within this stipulated 5-day period.
Okay, let me come back to you now, Dr. Fatoye. The reason I asked that, even though he has clarified that it's just resident doctors, consultants, and others will be working, but then the question remains about Hippocratic oath. How can you justify this strike, knowing some harm may occur and patients that are in their care might get hurt?
Yeah, I mean, this always comes up, and it always comes up in issues of strikes, doctors striking. However, Hippocratic oath, of course, it started from the Greeks. It's not peculiar to Nigeria. Every doctor, I'm aware, everywhere takes that oath, and strikes are not peculiar to Nigeria. If I'm not wrong, I know that junior doctors in the NHS had a strike last month everywhere. So it's a general problem globally in terms of how do we fix a health workforce, especially those that heavily dependent on the public health system, on public resources. So we could argue on the ethical issues or Hippocratic oath and all that, but I'll prefer to just go on the reality. The reality is that these people are people. This is a profession for people, and it being a profession, it means that, of course, if you don't have job satisfaction, whatever oath you take then becomes consequential. That's the reality. The reality is that we always bring this up, and I feel like I understand that it's quite an emotive issue when we talk about doctors striking, especially as it relates to people's health, and there's that possibility of.
I mean, the service like doctors provide is different from any other essential service out there. I would like to explore that conversation further, but we are time constrained. So I'll go back to Dr. Oladapo. I want to ask you, since, you're on the ground here and you know where the shoe pinches the most, in your experience, in what ways the government is saying that they're trying to talk to you? The government, there is supposed to be a meeting today, if I understand. I don't know if that held. They've also said you shouldn't go on strike, that it is illegal. But in what ways can government show commitment to addressing the challenges faced by resident doctors that would give you some confidence to stop the strike?
Thank you very much. The most intriguing part of this strike action is the fact that the Federal Ministry of Health and the Federal Ministry of Labor did not accede to open any negotiations with the National Association of Resident Doctors in the last 2 weeks that we gave them an ultimatum. In the last 48 hours, there have been posturing in the media that they were offering to give us or to open negotiations. However, I'm not aware of any of those negotiations that have been held because the government have been very much just paid lip service to this negotiation. We are open to the negotiations. The national president has been in Abuja, is open to all of these negotiations, and members of the National Executive Council are also very much present with him, and we're ready to attend all of the negotiations and the meetings that the government is calling. And when they do present reasonable interventions, some which are not even financial.
It is, I'm sorry to interject, Dr. Oladapo.
And we're thinking of our patients and the healthcare sector in general in Nigeria.
Yeah.
Because we do not want our patients to suffer. Neither do we want Nigerians to also suffer the lack of health care. But with the current state of
I mean, everybody in this country, to be fair to you, everybody in this country knows that the health sector requires a whole lot of work. And it is quite concerning what you've said, that the government come on the media and they say that they are taking action, but none of that is actually happening in ways that are impactful to what you are saying, to your demands. We hope for the best as always, and we do believe that dialogue is the way to go. Thank you very much, gentlemen, for giving us your time. Dr. John Oladapo, General Secretary, Association of Resident Doctors, UCH Ibadan, Oyo State, and Bernard Fatoye, Global Health and Development Specialist, United States. Thank you again.
All right, thanks.
Thank you very much.
That's where we'll leave it for today. The program returns same time tomorrow. As always, I thank you for your kind attention.